Hi everyone, I'm Aaron with Altitude Physical Therapy and wanted to talk about a topic that is commonly misunderstood, and that's why does it take so long for our bodies to heal after an injury, whether that be a surgery or just any trauma in general? Well, to understand this means to understand how your body naturally heals itself. Our bodies have been very well designed in order to help heal from an injury. Now, as physical therapists, our role is to help facilitate this process. So let's talk a little bit about what that process looks like. Now, there are 4 phases when it comes to healing. The first is really just the bleeding phase. It's when that acute trauma has actually happened. And we quickly transition into what's called the inflammatory phase. The inflammatory phase starts around 6, maybe 8 hours after an injury and peaks, well, around maybe 1 or 3 days. Now, during this phase, you might notice some localized swelling, redness, maybe some increase in temperature and pain at that site. But what's actually happening is your body is bringing in a lot of new blood and nutrients into that site. Now, what's important about this is extremely important to hold off infection. The cells that are coming in help clean the wound so that it can now properly heal. Now, the inflammatory phase is often the phase that often gets a very negative rap, we'll say. It's, we gotta get rid of inflammation as fast as we can. Now, by doing this, what we can actually do is prolong or stall this healing process. So allowing your body to have inflammation actually isn't all that bad. Now, what we start to see is this phase, although it peaks at 1 to 3 days, can last sometimes upwards of 2 or 3 weeks. But this is where some of these phases overlap. It's at 2 to 3 weeks that we now start to see what's called the proliferation phase start to peak. So as inflammation is going down, proliferation is going up. And what that is the repair phase. It's at this time that we start having scar tissue formation and adhesions form up, because your body is producing what's called collagen. And this is the substance that makes up your connective tissue, like your tendons and your ligaments. But during this phase, that collagen formation is a very weak type of collagen. And so if left uncared for, it's not going to be patterned well. By that I mean it's not going to be in the same direction and mimic some of your own natural tissue. So this is where physical therapy comes into play. Through different exercises and range of motion and manual therapy, we can help promote this healing and patterning of this collagen. Now, the proliferation phase, although it peaks at 2 to 3 weeks, can last upwards of 6 weeks. And this is where the overlap comes into that final phase, and that's the remodeling phase. Now, this tends to be the most overlooked phase, but one of the more important phases. The reason it gets overlooked is our bodies are actually starting to feel better after the initial injury. It's during this time that the collagen I was previously speaking of changes into a stronger type of collagen. It starts to mimic your original structures even more, and they allow them to be that much stronger. This is what allows you to get back to those activities without having as much pain. So the reason this gets overlooked, though, but is also so important is, well, it can last a long time as well. So you can see this remodeling phase last sometimes upwards of a year. But the reason that it's so important is this is where we can take full advantage of strengthening. And as physical therapists, this is when we really give you some really good home exercise programs. And why it's so important that when physical therapy finishes, or when you at least stop seeing a physical therapist, it doesn't mean that your exercise is done. So during this year period of remodeling, you can have the most impact on your future by continuing with the exercises, continue with the mobility so that your body can stay strong. Thanks everybody. I hope this was helpful.